So once again, welcome back to our channel Ach'z. So today we are going to discuss about the complete preparation guide or the topic prediction for OET exam on 24th May 2025. So we already done the video related to 10th. That time I saw some comments in correlation with exams were cancelled, and also in few centers only they cancelled the exam. If your center not conducted the exams means the worldwide it is cancelled. It's not like that. Okay, so before commenting something, try to know about the situation. Okay, don't mislead the students by the wrong information and all. So we are just making the video for the worldwide student. So whenever we are receiving some information related to OET exam in any test center, we are trying to include that in the video. It's not for any particular country and all. Based on the time slot, the question papers are also different. So try to understand everything before commenting. So now we are going to discuss about the topics or the area you need to focus if you are planning to write your exam on 24th of May. Okay, so prior to discussing the topic, I know that you all know the format, but I just want to brush up for the listening section, approximately 45 minutes divided into 3 parts. You know that. Part A, it's like a consultation extract. You will get 2 dialogues. And part B, that will be like a short workplace extract. You will get 6 recordings. And part C, it's like a presentation or an interview, like 2 recordings again. Now coming towards the reading module, 60 minutes, right? 60 minutes, you will get the 3 different parts. Part A, we will always call expeditious reading. You will get 4 short tests. Part B will be, you need to give more attention. Careful reading, we can say 6 short tests you will get. Part C, again careful reading, you will get 2 long extract or the test. Now coming towards the writing section, you will get 45 minutes of time. You will get 5 minutes to read your case note and 40 minutes for writing. So mostly the types of letters and all you know. So I'm not repeating that. But this time you need to focus towards what? That I will mention in the video. Now coming towards the speaking section, approximately 20 minutes, you will get 2 role play cards to press. That means 3 minutes to prepare and overall 5 minutes to present the role play card. So that's about the thing, about the format. I know that you know, but I just brushed out. That's it. Now coming towards the topic which you need to focus, I like to give 10 different topics under each category mainly. So now first about the listening module. So the first topic under listening section, that is post-operative care instruction, that will be related to any wound dressing or pain management or related to the mobility related. Second topic is medication administration, about the side effects or clarifying about the dosage, the route or adherence. The third one about the patient admission, gathering the patient history or the current complaints and all. Fourth one about the discharge planning, about the instruction, about the revisit or the follow-up care. That all things they can discuss over. Fifth topic is infection control protocol. They can discuss about this isolation procedure or about the hygiene technique and all, or the practices. Sixth one, emergency situation, like handling with the acute pain, like the chest pain or about the allergic reactions. Seventh one, mental health assessment, like identifying the signs of any anxiety or depression. Then eighth one, chronic disease management, like the diabetic or hypertension, like that condition. Ninth one, palliative care discussion, like end of life care or about the family support and all. And the last topic is interprofessional communication, that will be collaborating with your healthcare team, especially the last portion and all they can give in relation with that. So that's about the 10 different topics you need to focus under listening section. Why I am hurry-burry in the sense, I don't want to make this video too long, then it will be boring for you. I don't want to include so many unwanted information now. Already you are preparing with the things and it is the last minute time, and also I don't want to make the things more complicated. Just need to be more specific enough. That's why I'm just giving the topics only. So now coming towards the reading module. So I will mention the topics under part A, part B and part C. Then it will be easy for you. Now first about the part A, the topics you need to focus. First about diabetic mellitus, type 1 or the type 2. So they can just give about the blood sugar monitoring or the insulin administration or the diet management. These all are the areas they can describe. Second topic is hypertension. Again, they can give the guidelines for the blood pressure monitoring or recording about anti-hypertensive drugs, the medication instruction and all. Third topic is about the asthma management. Again, the inhaler use, about this flow meter reading, peak flow meter reading. So the fourth topic is stroke, CVA, about the immediate or the post-stroke care and all. So in that they can mention about the fast signs or about this thrombolysis protocols or rehabilitation exercises and all. Then the fifth topic is heart attack or myocardial infarction. They can give this ECG interpretation or about the chest pain assessment. Then the sixth one is urinary tract infection or UTI, we can say, symptoms or the antibiotic use or the catheter care instructions. Seventh one about this wound care or about the pressure injuries, dressing management or about this Braden scale or signs of infection. Then the eighth one, anaphylaxis or allergic reactions they can give, like emergency management or epinephrine administration, patient education. Then ninth one about COPD, chronic obstructive pulmonary disease, oxygen therapy or the breathing technique, smoking cessation advices. And the 10th one, dehydration and the fluid balance. In that they can mention about this oral rehydration methods, IV fluid protocols, monitoring the input and output. So these are the main 10 topic I like to recommend in part A. Now we will move on to the part B section. You will get 6 short workplace related tests. So that may be any policies or notice or any type of memo. So the topics which you need to focus, I just give the list. First one is incident reporting policy. Second one, nurse to patient ratio related guidelines. Third one, that will be shift handover communication procedure. Fourth one, clinical waste disposal instruction. Fifth one, about the personal protective equipment, about PPE use policy. Sixth one, the changes to fall prevention protocols. Seventh one, hand hygiene related notice. Then eighth one, IV cannulation, like the training schedule for this IV cannulation. Ninth one, about the COVID-19 triage, the revised guidelines for the triage or emergency triage and all. Then the last one, 10th one, policy update on this pressure area risk assessment. So these are the 10 different area or the topic under part B you need to focus. Now coming towards the reading part C, that too long detailed reading section, we can say the long test you will get, that will be the portion of any journal or any articles and all. So the topics you need to focus. So first one is improving patient outcomes through holistic nursing. Second one, the role of evidence-based practice in this modern nursing. Third one, impact of nurse burnout on this patient safety. Fourth one, communication barriers in multicultural healthcare setting. Fifth one, the future of nursing in a digitally integrated healthcare system, about this technology and health in correlation. Sixth one, ethical challenges in end-of-life nursing care. Seventh one, telemedicine or remote patient monitoring and the implication of that in nurses. Eighth one, developing leadership skills among clinical nurses. Ninth one, the effect of nurse staffing level on hospital mortality. And the 10th one, integrating mental health support in general ward nursing. So these associated passages, if you want, means I will publish that in our Facebook page. So we just updated more samples over there. Okay, so now we will discuss about the next module, writing. As you know, we have around 10 different types of letters they can ask for: transferred or discharge or advice, or that may be any type of community care plan, follow-up letters or pre-operative assessment letter or health promotion letter. Different types of letters we have, but this time you need to focus on two different areas. One is transfer letter and second one is referral letter. These are the two different areas you need to focus for this specific test date. I like to suggest some topics also under this. I will just classify and give under referral letter what all things you need to focus, and also for this transfer letter what all things you need to focus. So first about the referral letter topic. One is referral letter to this dietitian for the obesity management. The patient is struggling with this weight gain, so they will give about this poor dietary habit, or the BMI will be over 30 and all. So like that instructions they will give. So that second topic is a referral to the physiotherapist for the post-stroke rehabilitation. Then the next one, a referral to the community mental health nurse. So this area you need to practice with, okay. Mental health and all is not that much common, so some students find difficulty to convey the idea, so you need to focus on that. So they can give the instruction about the life stressors or about the signs of depression and all. So the fourth one is referral related to dermatologist for any chronic eczema condition. Then fifth one, referral to the diabetic educator, again common topic only. Sixth one, a referral to the podiatrist about this diabetic foot ulcer. Seventh one, a referral to any speech therapist for any swallowing difficulty. So about the post-stroke patient and all, like the dysphagia, that signs and all. Next one, the patient with the hearing imbalance or hearing lost. So you need to write a letter to audiologist. Ninth one, referral related to cardiologist for suspected angina. And to the last one, referral related to the occupational therapist for this home safety assessment. So elderly patient with the recent fall history. So I think this particular letter they asked recently also. So these all are the 10 different area under referral letter you need to focus towards. Now about the transfer letter. So first letter type is a transfer to rehabilitation facility after this hip replacement surgery. Like after the surgery, the patient need any special attention or about this physical therapy and all. The second one, transfer to the palliative care unit. The patient is terminally ill and she need comfort focused care and all. Now the third one is transfer to psychiatric hospital following the suicidal attempt. Fourth one, transfer to the nursing home for this long-term care. Again, the patient with dementia or the high dependency. Fifth one, transfer to the maternity ward after this emergency admission. Then the sixth one, transfer to the cardiac unit after this MI, myocardial infarction or the heart attack. Then seventh one, transfer to the infectious disease ward for this tuberculosis treatment. Eighth one, transfer to the surgical unit for appendectomy. Ninth one, transfer to the pediatric ward for respiratory infection. And to the 10th one, transfer to the neurology department for seizure monitoring. So that's about the 10 different letter type you need to focus towards. At least 2 letters you are covering in each day. One transfer letter and one referral letter. You can just cover in each day, then you will finish before 24th. Now coming towards the last module speaking, and again the role play scenarios I like to suggest is first one, managing the post-operative pain. So discussing about the pain relief options with the patient. Second one, educating on the medication usage, how to use the prescribed medication, especially if it is newly started. Third one is addressing the lifestyle changes that may be about the exercise or the diet or smoking cessation. Fourth one, handling emotional distress if the patient is very anxious or upset. Fifth one, explaining the procedure. You need to describe about the upcoming surgery or any diagnostic test and all. Sixth one, dealing with non-complaints, which means you need to encourage the adherence to the treatment plans and all. Then the seventh one, discussing the test result. You need to communicate about the lab or the X-ray implications or findings. Eighth one, providing discharge instruction. What all are the things they want to follow up in the home care when they want to come back for the revisit or re-checkup. Okay, eighth one, about providing discharge instruction. You need to instruct about the home care and about the follow-up and all. Ninth one, responding to complaints. You need to address the patient concerns very empathetically. Then 10th one, collaborating with colleagues, discussing the patient care with other healthcare professionals. So that's about the 10 different role play cards. So again, I just want to mention that under each module, I included 10 different topics only, and I just arranged specifically for this writing module only under referral and also under this transfer later. So I hope this section will help you out to prepare for your OET exam, and definitely I can assure you that you will get to the topics which I mentioned. So try to concentrate on that. It's like a last minute guide. So no one is there to guide you, and no one is there to see that this is the area you need to focus means. So you can just take this video and to prepare accordingly. So thank you so much for your time over here. Take proper rest, take good food, fluid intake, that is important, and proper sleep pattern, again important. It's like an English proficiency exam. They are trying to assess your English level. But OET, in the sense, we need some medical knowledge also. That's why I'm mentioning some topics which you need to focus towards, because we have a range of topics under medical sector. So these are the area you need to give more attention towards. So all the very best. So if you are under any institute or under any trainer means, you can just discuss with them about this topic. They can also help you out or give a proper guideline. So all the very best again, and God bless you all. Try to comment over your experience soon after the exam. If you find these videos useful means, try to recommend this channel to other students. They will also get benefit from that. So I will come out with the question paper discussion from different time zone after the exam. So you can just wait and see for that. Again, God bless you all, and thank you so much for your time over here.